Dr. Tim de Maayer has been reinstated at the Rahima Moosa Mother and Child Hospital. De Maayer's suspension was lifted following a meeting between Health MEC, Dr. Nomathemba Mokgethi, and the hospital CEO, Dr. Nozuko Mkabayi. Many believe that de Maayer's suspension was a result of his courage to pen an open letter to administrators at the Gauteng Health Department, in which he decried the state of affairs at the hospital. In the letter, de Maayer states that the poor conditions in the province's public hospitals contribute to children's deaths. Now, for a reaction on this, I'm joined by Dr. Mvuyisi Mzukwa, Chairperson of the South African Medical Association. Doc, very good afternoon. Good to speak to you. Now, this is basically what happened. Dr. Tim de Maayer put in an open letter. Next thing, he is suspended. And then the day later, he is reinstated. Your reaction to these three events?
Good afternoon to you and to your viewers, and thanks for having us in your beautiful program. We obviously were shocked and we were angry as well that here is a doctor who has been talking to the institution, exhausting all the internal processes of addressing issues, and nothing materialized. Now that doctor gets frustrated, writes an open letter in the form of an article, and then instead of authorities listening to the content, then they target the messenger. So we find it very strange that, at this day and age, in the democratic dispensation, we can just simply have a person, authorities abusing power, instead of assisting those that should be assisted. So we're taken aback. It reminded us of the old apartheid days when doctors, when authorities used to abuse power, and we didn't expect it in the democratic dispensation.
Now, when stuff like this happens in a democratic dispensation, as you suggest, do you get the feeling that the CEO of the hospital is hiding something by firing, or rather suspending Dr. de Maayer?
Well, we think it was just a knee-jerk reaction. Because, if somebody raises issues, you should be interacting with the issues that are being raised by that person instead of, playing the man. Instead of using that energy that they have, to attend to, the cries on the ground. We expected the CEO to know better and to actually use her energy to improve the situation on the ground, instead of running around, angry at a doctor who's speaking out. So we really think that they should rechannel their energy, into, making sure that things are being done, and, doctors and all healthcare workers are not really finding themselves not knowing what to do, because there's no material on the ground, there are no medicines, there's no water, there's poor sanitation. Everything in the hospital is just broken down. What do you expect of those doctors?
Now, you suggest that it was a knee-jerk reaction, but one would assume that if you are suspending a doctor, that there will be a consultative process before you come up with the suspension. I certainly get the impression that there is more to this than just a knee-jerk reaction.
Well, when, in a country where there's abuse of power, there is no time for consultation. People don't have time to consult. We have seen ministers, we have seen MECs dismissing a doctor in a media interview. That's how, this thing is. You'll recall some other time in Mpumalanga, when one of the ministers just, dismissed a doctor like that in the media. That's how you can abuse power and forget about the laws of the land, including the Labor Relations Act. We've already seen, this wide abuse of doctors. Like, for example, you may be aware of the case of Dr. Dan Sithole, who was handcuffed outside of the Wombats Hospital, with a court order, reinstating him, back to work. And how that power has been abused by authorities, in that province. So the same thing, we're not really surprised that they did the same thing in Gauteng.
Well, I suppose it's unfortunate that they react so quickly to a letter, such as the one penned by Dr. de Maayer, and not so much the issues. Now, I'd just like to read an excerpt from that letter which he wrote, and it says, and I quote, "Or even better, come and see how hospital-acquired infections spread like wildfire through the neonatal ward because the taps are dry, and washing your hands while lifting a 5-liter water container after examining each child is just not feasible. How is the department tackling these issues?" Now, this is sad, to say the least. I'm out of words to describe the emotion that one goes through when they read this.
Well, look, I mean, doctors and the other healthcare workers, that's what they experience on the ground. That is what we've been, telling the department. What we expected to happen now, instead of harassing a doctor, we expected the department to, convene a meeting with the concerned practitioners, sit down with them and listen, and then implement those things, including the MEC, the Premier as well, to say,
but
we're listening to you.
Dr. Mzukwa, allow me to come in there. You are suggesting
Yes.
that the CEO of the hospital should sit down with the doctors concerned to discuss that there is no running water, to discuss that there are power cuts in a hospital, to discuss that there are no medicines. Now, this is the core function of a hospital that doesn't require a CEO to be sat down and have a conversation about it.
No, I fully agree with you. I'm saying instead of suspending a doctor, they should have called that doctor, including, senior officials in the department, to say, we have heard your cry. How do we intervene, from a Premier's office, from the MEC's office? That's the intervention I'm talking about. Instead of harassing a doctor, that's what we expect, authorities to do. And really to be harassing a doctor and even removing that doctor to provide a service so crucial, to the vulnerable, the kids or children, and you just, instead of addressing the issues, you just simply remove the doctor from the work. It was surprising to us, and we don't know how people resolve issues using those tactics.
Dr. Mzukwa, final reaction to this. Dr. de Maayer wrote that the horrendous conditions in our public hospitals contributed to children's deaths. Now, this is a damning allegation. Does this pave way for Rahima Moosa Child Mother Hospital or the Department, certainly of Health, to being sued?
Well, we expect that there should be a follow-up on these issues. It's not the first time that doctors are raising these issues on the ground. And you know that absence of resources or limitations in terms of resources, they will ultimately contribute to the death of a patient. If you do not have, for example, if you don't have water, what do you expect? You expect, that there'll be an outbreak of infections in the hospital, because the hospital environment, how it is in terms of infections. That's the last thing you cannot not have in a hospital setting. The other thing is, the broken machineries that are out there, the shortages of staff and everything else that has been mentioned. The conditions in the hospital, the absence of safety measures on the ground. Those are the issues that, healthcare workers are saying, let us have these things and do our job. Our only thing is to do our job, and we don't want anything else. He was not complaining about salaries, for example. He was only complaining about the conditions of work, in the workplace.
Dr. Mzukwa, finally, talk to me about the conversations that you are certainly having with individuals like the Premier, David Makhura, who was very quick to respond and say that it's not acceptable for Dr. de Maayer to be suspended. But are we getting an equally quick reaction to deal with the problems on the ground?
No, we are not getting that quick response. But we are, on our side, have reached out. Our CEO is reaching out to the Department of Health, to have these issues that were raised by Tim, to be discussed, and that there should be a resolution on those. Because we don't want, frustrating doctors out of the public sector, going to private and going abroad. We want issues to be resolved. I mean, those doctors, they've spent their time in the public sector because they want to serve. They have a passion to serve in the country. And the last thing that you can do to them is to frustrate them.
Dr. Mvuyisi Mzukwa, Chairperson of the South African Medical Association, thank you for your time this afternoon, speaking to us, unpacking, in fact, the issue around the suspension and reinstatement of Dr. Tim de Maayer.